Hello, and welcome to How to Talk About HPV with Your Loved Ones. On behalf of Head and Neck Cancer Alliance and HPV Cancers Alliance, we are so glad you're here today. My name is Danielle Weed, and I'll be your host. Our goal today is to provide a high level of understanding of the human papillomavirus, HPV, and help so many discuss this often taboo subject with partners, family, and friends. HPV is a pervasive and prevalent virus that is attributable to 6 cancers. By learning and then sharing this information, you may be able to save a life. It may even be your own. If you have any questions for our guests today, please type them in the comments below. Our online moderator will do their best to answer your questions and provide links to resources. Please be patient with us as we may not be able to get to all of your questions during the event. Before I introduce our first guest, I encourage you to give us a thumbs up. And if you find value in today's webinar, please share it on your social media feed or with a friend. When we spread knowledge, we save lives. Our first guest knows what it's like to have her world turned upside down by an HPV-associated cancer diagnosis. She's best known for her Emmy and Golden Globe nominated work as Bree Vandekamp on Desperate Housewives. But actress Marsha Cross is more than that. She is a mother, a wife, a sister, a daughter, a friend, and an HPV-associated cancer survivor and thriver. In 2019, when Marsha publicly announced that she had survived anal cancer, she began making a whole new name for herself as an advocate for HPV awareness and the destigmatization of HPV-associated cancers. Ladies and gentlemen, I am thrilled to introduce the lovely and talented co-founder of HPV Cancers Alliance, Marsha Cross.
Thank you so much for that introduction, Danielle. Yes, I am and have become a huge advocate for educating the public about HPV because when I was diagnosed, I had no idea why I got anal cancer, even though my husband had been diagnosed with throat cancer 10 years before. And I think I'm a pretty smart woman, so it seemed incredible to me that having 2 people in the same family diagnosed with cancers caused by the same virus, that I should be so uneducated about it. And though I would like to have stuck my head in the sand and gone about my life, I realized that I had a job to do, and that was to help educate the public, because these are cancers that, when caught early enough, can be cured. And certainly that was the case with my husband. And as we'll hear with Dr. Pfister, they have amazing new treatments for throat cancer with seriously reduced side effects, which I'm so happy to hear about because that wasn't the case with my husband. And though I will not meet you in person, Dr. Pfister, I just want to say thank you for that, because I know that you are changing the lives of many, many cancer patients that are affected by head and neck cancer. And as for today, I think we have a wonderful panels and sessions ahead of us to help, loosen up and figure out how to talk to people about HPV. I personally just think you barrel on in and talk about it and remind people that it's as common as the common cold or COVID, and maybe we're less frightened of viruses now that we were all inundated with COVID for 2 years and counting, so that we can tackle this head on. Because what's so important to realize is that with education, we can save lives, and it seems like the simplest thing in the world, but there's not enough of it. And so here we are today, wanting to help you understand how to talk to people about HPV, how to talk to people about an HPV cancer diagnosis. And as I will harp on later, there is absolutely no shame about it. You're not ashamed when you got the chicken pox as a kid, or when you get the common cold, or if you got COVID. So away we go, and I hope this helps everybody feel a little more comfortable when they hear HPV. Thank you.
Our keynote speaker today is Dr. David Pfister. Dr. Pfister is an internationally recognized expert in the management of head and neck tumors, and he has pioneered the development of programs intended to preserve function without compromising survival. He is the 2011 recipient of the Willett F. Whitmore Award for Clinical Excellence at Memorial Sloan Kettering Cancer Center. He is a graduate from University of Pennsylvania, where he completed a residency in internal medicine at the Hospital of the University of Pennsylvania. He was a Robert Wood Johnson Clinical Scholar and trained in clinical epidemiology at Yale University, and did a fellowship in medical oncology and hematology at Memorial Sloan Kettering Cancer Center. Dr. Pfister holds the ranks of Professor of Medicine at Weill Cornell Medical College and member at Memorial Sloan Kettering Cancer Center, where he is chief of the Head and Neck Oncology Service within the Department of Medicine and co-leader of the Head and Neck Cancer Disease Management Team. Welcome, Dr. Pfister.
Thank you, Danielle, for that kind introduction. And I'm delighted to be here today to be part of this conference. Over the next few minutes, I'm going to cover a little ground at a very high level about what we know about HPV, some exciting things which are shortly in progress or coming down the pike about HPV research and therapy, and just a few, I've been an oncologist for 3 decades, and just a few things just to bring us back to the patient that just are things which I do like to share. So in terms of HPV, HPV infections, very common, okay? New infections in the United States in the millions. Fortunately, your immune system takes care of a lot of those. And so it's a big inverted pyramid so that only a subset of those actually turn out to be cancer. And so the number of HPV-related cancers is typically in the mid-5 figures. Many HPV subtypes that are out there, which has helped inform vaccine development, which I'm going to talk about shortly. What's a very encouraging thing, much of my career in head and neck malignancy was with traditional head and neck related cancers, or tobacco and alcohol related. HPV came on the scene over the last couple decades, and the prognosis of these patients is incrementally better. So much better, in fact, that we have a separate staging system now, because to really evaluate new therapies, the patients are doing so much better with HPV-related disease that it was kind of comparing apples to oranges, and it almost got confusing. So many things there that help guide us and reflect our growing knowledge. And I think lastly, in terms of what we know now, is that we have a highly effective, highly safe vaccine already to prevent these infections. And I think that marked decrease in infection rates among those that get the vaccine. We actually see already a herd effect on people that get vaccinated that then that protect individuals who never got vaccinated. So very exciting about the therapeutic benefit. And while a lot of this work was done to prevent gynecologic malignancy, cervix and genital warts and things like that, because the HPV subtypes are shared, it's been more recently approved to prevent head and neck cancers. So, a lot of exciting stuff going in the vaccine space. So let me use that as a segue to talk a little bit about innovations in therapy. So I just talked about a vaccine as a way to prevent the infection, so prevent the cancer. You can also use similar technologies as a therapeutic to treat cancer. And, we've used engineered viral vectors to help here. And so we're very involved in this work at Memorial Sloan Kettering. And I think there's all exciting things coming with that. The biology of these tumors, we've learned a lot about, and there are certain unique targets that are unique to these HPV-related tumors I see versus ones which are HPV negative. And this helps inform in an era of precision medicine target therapy, drug development to target these. I said that the cure rate is extremely high. And so these patients are often a little younger because they don't have some of the traditional tobacco alcohol risk factors. So quality of life and cure need to go hand in hand. So a big area of research is looking for ways to decrease toxicity. And so we have a very innovative study where we use the oxygen level in the tumor to markedly decrease the radiation treatment. So a lot of hopeful things happening here, which I think are going to impact the standard of care within certainly the not distant future. Let me end just with a few comments about, as a provider taking care of patients with HPV-related cancers. I often say that, information is often the most therapeutic thing we provide. We can often talk a lot about technology and the research, but, that information is, really important to not just get across, but get across effectively. With this being kind of viewed as a sexually transmitted disease, there's often a lot of stigma with it, and it translates into being anxiety, being afraid to talk about it, vaccine hesitancy. I mentioned the vaccine. Unfortunately, before the pandemic, a significant proportion of adolescents in the United States had not had their full, complete set of vaccination. That's only gotten worse, actually, during the pandemic. So we've got this tool, and how do we, get that tool out there? And I think also, how do we address some of the concerns of patients so we decrease anxiety that enhances compliance and really get this conversation going? And one of the things that came out of research was that there are a lot of questions patients are almost afraid to ask. And so we actually developed an education tool, which is the top 10 questions that patients who have HPV-related cancer want to know. Am I going to give it to my spouse or partner? Am I going to give it to my kid? Can I hug my kid? Can I hold their sippy cup? Can I wash the dishes? Can I still have sex? A lot of these things that we have good answers to. And if we can get sort of those answered, allows people to focus on fighting, their cancer and also decreases the anxiety among their family members. So again, great pleasure being here today. I think a lot to be hopeful for. Really, as a provider, very grateful for the work of the HPV Cancer Alliance and the work it does for patients. And thank you again for your attention.
Next up, it is my pleasure to introduce our first panel moderator. Shazia Ahmad has over 20 years of experience in the healthcare industry, and she is a recognized thought leader in patient advocacy. As the Senior Director of the Patient and Physician Services team at UBC, Shazia provides oversight and strategy on pharmaceutical support programs in areas such as patient recruitment, retention, safety, and more. She also sits on the advisory board for HPV Cancers Alliance. Welcome, Shazia. Thank you for moderating today's first panel.
Hello, I'm so pleased to moderate this session on speaking with your loved ones about HPV. Before we get started, I'd like to introduce the panel for this session. We are joined by Dr. Stephanie Blank. Dr. Blank is the Director of Gynecologic Oncology for the Mount Sinai Health System, a professor in the Department of Obstetrics, Gynecology, and Reproductive Science at the Icahn School of Medicine at Mount Sinai, Director of Oncology Programs for the Blavatnik Family Women's Health Research Institute, and the Director of Women's Health at the Blavatnik Family Chelsea Medical Center at Mount Sinai. Dr. Blank specializes in the treatment of patients with ovarian, cervical, and uterine cancers, and the care of women at increased genetic risk for gynecologic cancer. Dr. Blank serves on the Medical Advisory Board for the HPV Cancers Alliance. Thank you, Dr. Blank, for joining us. I'd also like to welcome Lillian Krappel. Lillian is the co-founder and executive director of the HPV Cancers Alliance. Lillian is a public speaker, entrepreneur, successful marketing strategist, and public relations expert. She's an anal cancer thriver, activist, and tireless pioneer advocating for the prevention and treatment of human papillomavirus, HPV. Her goal is to inspire others with her personal journey and to empower them with the education and awareness they need to manage their own health. Thank you, Lillian. And finally, a warm welcome to Dr. Liz Cash. Dr. Cash is a clinical health psychologist and director of the Head and Neck Cancer Outcomes Research Program at the University of Louisville. She also holds an adjunct position in the Department of Psychological and Brain Sciences at the University of Louisville. Thank you, Dr. Cash. Now let's get started with Dr. Blank. Dr. Blank, for one who receives a HPV diagnosis, what does that even mean?
So, thank you. Usually, someone will get the an HPV diagnosis from their gynecologist, if we're talking about a woman, and I am a gynecologic oncologist, so I'm going to answer questions from that perspective. So HPV stands for human papillomavirus, or it's the virus that's responsible for cervical dysplasia and can cause cervical cancer, as well as other cancers such as anal and head and neck and penile and others. So today, if a patient gets an HPV test, it's usually from a swab that's collected from the cervix, oftentimes at the time of a pelvic exam. And that swab is tested for DNA. And there are many strains or types of HPV. When somebody is told they're HPV positive, it usually means that that's a high-risk HPV that they have. And that means that that's one of the strains that's more likely to persist or potentially cause more changes.
Great, thank you. Another question for you, Dr. Blank. Some patients may not know the difference between HPV and abnormal pap test, as some gyns don't even say HPV, and some doctors just say abnormal cells. Any other advice to position it in another way?
Yeah, so just to explain the difference between HPV and an abnormal pap. So HPV is a test for the HPV virus. As I mentioned, it's a DNA test. A pap is a scraping of cells from the cervix, and basically those cells are examined under the microscope. And if there are abnormalities, you would have an abnormal pap test. So if you want to think of it sort of together, so HPV infection can cause changes in cells, and then those cells would look abnormal under the microscope. In people over the age of either 25 or 30 now, we do both HPV testing and the pap smear. And I think, recently the American Cancer Society has recommended that we go to primary HPV testing, and there's a lot of good reason for that.
Great. Yeah, another question for you is when you speak to your patient, how do you frame it?
Great question, because it's not, you can't just say you have HPV. It has to be a discussion. And so what I would tell a patient, I always say, it's very common. And anyone who's ever had sex is at risk, and it's not a sign of any off behavior in any way, shape, or form. I would say probably a majority of young people have had HPV or have been exposed to HPV. And so if the other thing that's really important to say to people, of course, I explain what HPV is, but then I also say it's not a reflection of when you got it. Having an HPV test doesn't mean you were exposed in the past 2 weeks, so it could have happened at any point in your life. I've had people get in fights over this, and certainly that's not appropriate. I then sort of, people can sort of kind of go a couple different ways with this. Sometimes they get very worried about passing it on to their partner, and basically I would tell such a person that it's already been passed back and forth, so it's not something that you can really do. The best thing that you can do if you have HPV, if you're a smoker, stop smoking, and anything that you can do to increase your immune system can help. So making sure to eat right, exercise, sleep. Additionally, there's some, eat a lot of broccoli. Those are things that I tell people to do when they have HPV. Another important thing is that having HPV doesn't mean you're going to have cancer. A lot of the times the immune system kicks in and can clear it. And sometimes it does not, but it just means you need to be followed a bit closer. Great.
Thank you, Dr. Blank. Another question for you, and more for physicians and younger doctors. What would be your recommendation and your advice to younger doctors and physicians?
Well, with regards to HPV, the most important thing is I would stress the importance of HPV vaccination. I ask people if they've been vaccinated, ask older people if their kids have been vaccinated. So I think that's the, really the most important thing that we can do. I mentioned before a little bit about primary HPV screening, and I think that's actually going to be the way of the future. So I make sure that people are using HPV testing properly. Smoking cessation should be a big part of any discussion here. And really importantly, no news is not good news in the world of cervical cancer screening. So people assume if they don't hear anything that everything's fine, but really I think it's really the doctor needs to tell the patient that you need to get your results, and the patient needs to know that if they don't hear in 2 weeks or something, they should call. So you can't just get a pap smear and not follow up on it, or you can't just do a pap smear for a patient, not follow up on it. So the follow-up is really, really key.
Yeah, that's something really critical. I mean, Dr. Blank, like there's so much, there's that communication and how it's approached is really critical. And then the follow-up, thank you very much.
Thank you.
Okay, I'd like to now turn to Lillian, who is a survivor from anal cancer and working really hard in that education and awareness of the HPV vaccine. Lillian, I'd like you to touch on your personal story. How did you react when you found out that you had HPV?
So thank you, Shazia. When I found out I had HPV, I was in my 20s, and my gynecologist said, you have HPV. We need to follow up on this, come back for a colposcopy, which is a better look at the cells. And I came back and I was clear, but then, you have to be aware that, that you have this. And so I reacted with, okay, I have this and this is knowledge, and I have to just be aware of this.
Did you share the news with anyone?
I probably shared it with a few friends, but I have to say, I didn't think it was a big deal at that point. I didn't, because again, I told it was very common as well.
Great. Okay. And then what has been your follow-up plan once you were diagnosed?
So I was going for, I'm very good with my doctor appointments, and I'm a big believer in preventative, and I was going for my pap smears every year. And over the course of 20 years from when I was diagnosed with HPV, some paps again came back, showing the HPV was present. And again, I'd have to go back and get further testing, but then it would clear. So in my mind, I was okay. I was good to go. Cancer was never, ever on my, in the horizon for me.
Wow. So then fast forward, then you had the diagnosis.
Yes.
Yeah.
Yes. So actually I knew something was wrong because I had blood when I went to the bathroom in the back. And I knew something was wrong. I went to my gynecologist and she said that I was fine. And I said, I don't think so. I'm not fine. And she actually did a rectal exam and said I was fine. And I said, no, I'm not fine. And I ended up going to another doctor, my gastroenterologist, who actually found the tumor by not only looking with a scope, but by palpating with his fingertips, and he found a hardening, like an induration. He said, this is not supposed to be there. So the hardening was the tumor, as opposed to what maybe some doctors or in my case, my doctor may have thought it was a hemorrhoid. I'm not sure, but he diagnosed it. And then I had a further test, a sigmoidoscopy, to confirm that I had anal cancer. And the doctor told me, it's not the best news. You have anal cancer. He said, and it's treatable. And I looked at my watch and I said, okay, let's do this. I literally, all I heard was the word treatable.
Wow. That's incredible, Lillian. Yeah. And I think from that experience, what's really inspiring to so many is you started the HPV Cancers Alliance with actress Marsha Cross and Dan Lifton. Can you talk about that? Why did you feel it was so important to do that?
Yes, yes, absolutely. So the reason that I thought it was so important to do that was because as I was going through my treatment, getting chemo radiation and encountering others that had the same type of cancer, whether it was anal cancer or oral pharyngeal, which is also one of the 6 cancers of HPV, I found a similar thread. And the thread was, you know, I'm not trying to blame any doctors or anything, but the thread was, you know, it was thought to be a hemorrhoid, or it wasn't diagnosed, or it wasn't caught. And I thought to myself, and this was 5 years ago, and I thought to myself, oh, it doesn't seem that, you know, that these HPV cancers are on the radars of not only the public, but the medical societies. So I said, wow, you know, this is such a common cancer and people are dying and nobody should die of it. And, you know, we can do something about this. And then I really got, you know, very educated in what it is. And I started doing some volunteer work and for the Anal Cancer Foundation. And then I enlisted Marsha because Marsha had the same cancer as me. And she decided, you know what, she wants to also help out. And then, and Dan Lifton has been absolutely wonderful support in getting the organization off the ground.
That's incredible. And it for me, it's been such an incredible experience being part of the organization and supporting the mission of education, because there's the HPV associated cancers that can be preventable by the HPV vaccine, and truly incredible work. Thank you, Lillian.
Thank you.
How do you feel now about everything almost 5 years out?
Well, I feel good. And I have to say, you know, I speak to patients all over the world, and sometimes I have to temper my excitement and how good I feel, because it's not the case with other patients in different parts of the country where they're telling me, you know, they're having these side effects, or of course it could be their individual bodies. We're all different. But I was treated at a wonderful hospital in New York City, and I really did very well, and I feel great. And I had a big party when I was finished to thank all the doctors and the nurses. And I'm thinking about another party when I'm 5 years out, which will be in January. So I feel good.
That's awesome. That's great. So glad you're doing well, Lillian. Thank you.
Thank you.
Now I have a question for Dr. Cash. Dr. Cash, with your work that you are involved in oncology and with HPV, can you address the stigma of the HPV diagnosis and how we as a community can help to counter its taboo nature and to bring really a higher level of understanding for the newly diagnosed?
Yeah, absolutely. That's a great question. And I think that's something that we can talk about both from an individual's perspective as well as from the community level. You know, one thing I want to follow up on what Lillian said, you know, she's a shining example of how to be an advocate for yourself. So, you know, if you feel something's wrong and you're not getting the answers you feel are sufficient for you, keep seeking those answers, advocate for yourself, you know, find the avenues that you need to get the help that you need to feel reassured, and make sure that, you know, you feel like you're getting the care that you deserve. And the other thing that, you know, Lillian talked about, she brought up a range of different emotional responses to the HPV diagnosis itself, to facing, you know, a diagnosis of anal cancer, the treatment of that cancer, and all of these different, you know, sort of complex issues that come along with these diagnoses. And, you know, the emotions that one person might experience can be very mixed, and there can be a sense of helplessness in there. There can be some anger. There can be some feelings of, surprise or maybe embarrassment. It can sort of come out of left field for someone. There's, of course, sadness and then some optimism and some sort of like, this motivation to power through it and kind of get back to what feels like a normal daily routine. All of those responses are valid. There is no wrong way to feel about something like this. And so I think that for a lot of folks, it's hard to remember that, just because you feel a certain way about it and someone else feels a different way about it, doesn't mean that either of you are wrong. There is a vast array of the ways that we can respond to a medical diagnosis like this, and they're all appropriate. And finding ways to manage those emotions and make sure that you're getting the care and support that you need are really important. And I think, probably one of the biggest things that maybe folks think when they learn about an HPV diagnosis is that they did something wrong. And we want to make sure that individuals know that this doesn't mean that you've done anything wrong, or that you behaved in a way that you shouldn't have behaved, or that you engaged in a risky behavior that had some negative consequence. There should be no shame in getting an HPV infection. It's so common, and not all of them lead to, major issues for folks. And so, as has been mentioned earlier, sometimes these exposures happen and they are dormant or silent for years, and we don't know that we have them. And so it's incredibly common for lots of folks to have these issues and not even realize it. And so it's not a reflection of any one person's character or their values. And so folks shouldn't feel shame in being able to say that they have these infections if they feel that they want to share them. And they shouldn't feel like they need to apologize for having an HPV infection. It's just something that happens. And I think at the community level, what's really important is educating each other. This is where we have the real power to influence the understanding of what HPV is, where it comes from, what causes it, what it results in, what the strains are, what the potential consequences are, so that we can adequately address together in individual family units with our spouses, partners, children, even extended family, and as well as with our healthcare providers, to really make sure that we're addressing the problem from a proactive stance, making sure that necessary precautions are taken if they're needed to be taken, or getting an understanding of this is just something that isn't associated with high risk HPV, for example. Maybe it's a low risk strain and may never cause issues for someone, and so the need to worry about potential risk in the future is decreased for that person, and so they can get some assurance in knowing exactly what type of issue they're dealing with and what the best precautions are for them to take now and in the future.
Great, that's really helpful, Dr. Cash. And I think Lillian, you may have something to add there too.
Yeah, thank you, Dr. Cash. That was wonderful. What I was going to say is, because I didn't address it when I was speaking about the shame factor. Of course, when they told me I had anal cancer, I thought to myself, are you kidding? What am I going to be? Whoever thought I'd be the face of anal cancer, right? But the actual shock of I have cancer was greater to me than being embarrassed about the type of cancer, because I've always been healthy. I never even got the flu, hardly ever get sick, and I maintain a healthy lifestyle. The shock of you have cancer was much greater. But regarding the shame factor, I really I embraced it, and I said, you know what? It's cancer. It. Why can't we get cancer there? We can get cancer everywhere, and in our ear, anywhere. So I embraced it. And then one of the things that Marcia and I have discussed is, wait a minute, we have cancer, and now we're going to be shamed because of the type of cancer we have. So honestly, I really didn't care what anybody thought, and it was my opportunity to say, wow, this happened to me. This could happen to anybody. And I have many people, all ages, who come to me and say, I can't say the word anal cancer. I say, something else. And I said, well, you really should say what it is, because we have to bring attention to this.
Absolutely. Yeah. Thank you, Lillian. Dr. Blank, anything to add?
No, Lillian, your story is amazing. And Dr. Cash, really applaud the work that you're doing. Again, I couldn't agree more that about trying to destigmatize HPV. Again, it's very common. And that's not to minimize it. I don't mean to mean that people aren't going to be upset when they get it, but I think judgment should be gone. I mean, it's a health situation. It's like getting strep throat. I mean, I don't know. It's just a infection and you deal with it. So, and again, I'm not minimizing it, but luckily, I mean, it's lucky that we know how to deal with this. So I think you can take the information and empower yourself and get an HPV vaccine. That's another thing. Thank you.
Great. Yeah, absolutely. Thank you so much, Dr. Cash. Again, very, very important considerations and just really great points there. Okay.
Oh, I'm sorry for interrupting. I want to say that I got the vaccine at age 52. And another thing, a lot of people don't realize that the vaccine, you can get the vaccine, it's out there that it's been changed from 26 to 45, but I got it at 52. Dr. Blank, I just wanted to ask you, what do you think about that, getting the vaccine later in life, and even though you already have HPV?
Absolutely. I think that's great that you did that. I mean, it might not be covered, and that's one thing, but there is some data that after somebody has cervical dysplasia, even if they've had the vaccine before, getting it can still help keep that away. So I applaud, getting the vaccine for sure.
Great. Thank you, Lillian. Yeah, so this concludes our session for today. We really appreciate you joining. Thank you.
Thank you.
I'm excited to introduce the moderator for our next panel, the Executive Director of the Head and Neck Cancer Alliance. Amanda Hollinger has more than 20 years of experience in the nonprofit and public sector and has served as the Executive Director of the Head and Neck Cancer Alliance since 2018. Head and neck cancer has impacted the lives of family members close to her, and Amanda is committed to helping Head and Neck Cancer Alliance fulfill its vision of saving lives through prevention, education, and advocacy. Amanda, we are so pleased to have you moderate our next panel.
Thank you, Danielle. I'm pleased to be here. So in the first panel, we learned more about what an HPV diagnosis means. And today we'll be talking more about sharing a HPV cancer diagnosis. We are joined by a wonderful team of panelists whom I'll introduce briefly before we move into our discussion. Dr. Carol Fakhri earned her medical degree at Johns Hopkins University, where she also completed her internship and residency in otolaryngology, head and neck surgery. Dr. Fakhri has appointments in the Johns Hopkins Sidney Kimmel Cancer Center, Department of Oncology, and the Johns Hopkins Bloomberg School of Public Health, Department of Epidemiology. Her clinical and research interests include determining the prognostic significance of human papillomavirus in head and neck cancers, understanding the changing landscape of head and neck cancer, oral HPV natural history, and innovative mechanisms for the screening and early discovery of oropharyngeal cancers. Dr. Liz Cash is an associate professor, clinical health psychologist, and director of research for the Department of Otolaryngology, Head and Neck Surgery, and Communicative Disorders at the University of Louisville School of Medicine in Kentucky. As part of the multidisciplinary head and neck cancer team at her institution, Dr. Cash has instituted services to offer patients supportive psychological care, consulted with a team of physicians on social aspects of treatment decisions, and has acted as a liaison to ensure patients receive needed services. In her research, Dr. Cash investigates how the effects of anxiety, depression, sleep disruption, and stress response systems may adversely affect adequate head and neck cancer control and survival. And Jason Mendelson is co-founder and president of Asher Group, LLC, a privately held, nationally licensed firm specializing in the secondary market for life insurance. He is an HPV tonsil cancer survivor and serves on the executive committee and board of the Head and Neck Cancer Alliance. Jason was first diagnosed back in May 2014 and shortly thereafter had a radical tonsillectomy neck dissection, followed by 7 weeks of chemo, radiation, and a feeding tube. He made the decision to share his cancer story publicly so that others could learn about HPV-related oral cancer screenings, including the HPV vaccine. He created a website, www.supermanhpv.com, to inspire, educate, and encourage others diagnosed with HPV-related oral cancer. Thank you, everyone, for joining us today. And our first question will be for Dr. Fakhri. What are some helpful questions patients should be asking their medical team about an HPV-associated cancer diagnosis?
Well, thanks for that question, Amanda, and thanks for the introduction. So I think fundamentally, any question that comes to mind is an important question to ask. And whether that's the patient, the family, friends, we as physicians are there to help our patients and to put them at ease and provide any information that we know or don't know. There are many questions that we don't know how to answer. But I think it's important to ask the question and for us to be honest about what we know, what we think in the absence of knowledge, and to direct people to the experts when we don't know the answers. I think based on what we know and how it affects treatment, I think probably the most important question to ask a physician is, what does this mean for me? And how does this affect my treatment? Am I eligible for clinical trials? Those, I think, are highly pertinent to clinical decision-making. There are many other important questions that get at the sense of who we are as human beings and how we interact with the world, that patients should feel empowered to ask, and partners of those patients.
Thank you, Dr. Fakhri. Those are important points. And moving to Jason, I'm sure you had many questions when you were first diagnosed. Had you ever heard of HPV, and were you comfortable sharing your diagnosis with your family and friends?
Thank you for having me as well. And let me begin by saying I am not a doctor. I'm a survivor, so I don't give medical advice. No, you know what? I had known HPV was a sexually transmitted disease. I didn't know it was the most common. I certainly never heard of oropharyngeal cancer. In fact, the first time I knew that's what I had, I actually had to practice saying it repeatedly to be sure I pronounced it correctly. And I ended up, being diagnosed with HPV-related tonsil cancer. And not only had I never heard of HPV nor tonsil cancer, I had never known anyone to be diagnosed with it. Again, this is back in 2014. So it was, something I was completely not familiar with. And quite honestly, not until I decided to go public with my cancer story, did I ever even use the letters H, P, and V together. So again, no, I was not familiar with it at all. Was your second question how to explain it to family?
Yeah, and then how were you comfortable, or how did you share your diagnosis?
Carol, do you want to go ahead?
I was just going to make a clarification. HPV is not a sexually transmitted disease, but an infection. Some people happen to get a disease or malignancy from it.
So let me say, once again, as I said up front, this is why I tell you I am not a doctor. Just a survivor, because I give no medical advice and defer to doctors like Dr. Fakhri, who, because again, not a doctor. So thank you for saying that, because I never want to say anything that's not correct. In fact, my cancer story has been shared in over 100 countries. I better make sure I don't say that ever again. How did I explain it and share it with family is what your question was, correct?
Yes.
I had no stigma. When I found out about it, the whole idea of having an HPV related cancer didn't even cross my mind that I should be embarrassed about it. I hope when I make this next statistic, like when I say this next thing, it's correct, Carol, or Dr. Fakhri. I learned that 3 out of 4 adults by 30 have HPV, and it was very common. And I thought, if 3 out of 4 adults by 30 have this, I don't know why I would ever be embarrassed or anyone else would be embarrassed. So when I learned that, I decided I would go public and hopefully shared that message to stop others from ever feeling isolated, alone, or embarrassed.
Thank you, Jason.
Welcome.
And we know that upon learning of an HPV cancer diagnosis, many patients do go through a range of emotions that can manifest in things like anxiety or depression or other mental health concerns. And I wonder, Dr. Cash, if a patient is really struggling with the HPV associated diagnosis or depression related to their cancer diagnosis, what are some initial steps to help him or her?
Thanks, Amanda. That's a great question. I think Jason really nailed that point there. When you start to look for the information and gather your resources and figure out, okay, how common is this? What's the pattern here? Is there anything to learn about this and be concerned about? And that really can go a long way in sort of helping calm down some of those feelings of anxiety and perhaps some of those feelings of depression. Knowledge really is power here in situations like this. The range of emotional responses to learning about an HPV-associated cancer can, as you mentioned, be really quite mixed. Lots of patients experience some surprise or some embarrassment. Even some patients feel optimistic because they realize that there are differences in treatment, differences in outcomes for associated cancers, and so gives them a little bit of a different perspective on what can be a very challenging diagnosis. But we also want everyone to remember that, a feeling of sadness or anger or depression, all of those responses are valid. Everyone has a different way of responding. There's no wrong way of responding. It's very normal to have even a combination of all of those different emotions kind of rolling around all at once. What we want folks to remember is that, while those experiences are normal, they can make it more challenging to make sure we're adhering to treatment, getting our most effective care, thinking clearly when we need to ask questions to our physicians. So we try to remind folks that if those symptoms kind of stick around for a couple of weeks or more and they start to interfere with your ability to concentrate, get things done, carry on your daily activities as much as you would like, that's when it's time to start asking your physicians or leaning on your support networks to find additional resources that can be helpful to support someone when they're being challenged by those additional emotional experiences.
Thank you, Dr. Cash. Those are really important points. And this next question is for Dr. Fakhri. How important is it to share that the cancer is HPV attributed with family or friends? Are there situations where it might be best not to disclose the virus diagnosis?
It's not needed. As Jason said earlier, it's a very common sexually transmitted infection. And as I've heard someone say recently, to have the infection is to be human. And so there's no need to disclose it. There are sexually transmitted infections which do have to be disclosed, like syphilis, but there's no recommendation in the cervical literature even to disclose HPV.
Thank you. And this is just a follow-up question to that. What do you believe, Dr. Fakhri, would be beneficial in having others understand about HPV-associated cancers, just in terms of prevention, prevalence, awareness, things like that?
So we have a great way of preventing HPV-related malignancies, and that's with the vaccine. So I think that's probably the most important message to get out there. And that's really our ticket to changing the epidemiology of HPV-related cancers, and especially HPV-related oropharynx or head neck cancers. So we need boys and girls to get vaccinated so that we see a difference in the future.
And what are the ages that you can get vaccinated now? I know it's changed over time.
So it's up to age 45, and the idea is to get it before sexual debut. And so I want to say age 9 or 10 is the lower end of it, but don't quote me.
Great, yeah. And Dr. Cash, what are some of your recommendations that would help in discussing with your partner or spouse as to your HPV cancer diagnosis and concerns about it impacting them? How to talk about that?
Yeah, sure. That's also a great question. As Dr. Fakhri mentioned, there isn't a hard and fast recommendation that anyone, is required to disclose something like this. And so the determination to have a discussion like this really is a very personal one for our patients. And so everyone sort of approaches it in a different way. Some people feel it is a little risky or very challenging to have these conversations, or difficult, and can bring up some worry and some concerns about potential stigma that might be experienced. And so some of the recommendations that we make for patients who are, going through this decision is to first remember that it's okay to kind of take control of the conversation. It's, you're in the driver's seat, you get to define how it goes. You don't have to provide any more detail than you're willing to share with anyone. And second, you can prepare comments that would be helpful for you to have kind of in your back pocket in advance of a conversation in case you anticipate difficult questions coming up. So some examples of those are if we have individuals who are unfamiliar with some of the truths about HPV and associated cancers, or have heard some of the myths, or are kind of playing into the stigma that we see, we can reframe the discussion. So one way to do that is for someone to say, a lot of people have heard it that way, but in reality, this, and then kind of go through, what the factual information is about HPV and associated cancers. Oftentimes corrective responses can help. So if you are in a situation where you just don't want to share those details, if it's someone like a work colleague or an acquaintance where you just don't feel like going into that much personal detail, you can, patients can say something like, I don't know exactly how I got my cancer, and I don't want to spend my precious time worrying about it right now. I'm looking toward the future. Or something like, my doctor doesn't know exactly when or how I might have been exposed, or what exactly caused this, and so I prefer to focus on moving forward from here. And then sometimes, our close friends or even our partners can be upset about the diagnosis, or maybe again feel some of those that wide range of emotional experiences that we see that our patients experience. And so one way to sort of diffuse a tense situation like that, if there seems to be some anger or resentment or an argument impending, is for someone to acknowledge that their own message is coming from their own way of looking at things, and one person's perception might be different. And so instead of trying to tell someone they're wrong, or that they shouldn't feel or think a certain way, one person you can just respond, I don't agree with you, or I have a different opinion. Here's what mine is, and maybe just agree to disagree. And I think, that can be challenging, and it might be really kind of hard to approach a situation like that. But we think it's important to keep in mind that, one of the hallmarks of successful relationships is having these challenging conversations. And so in the end, oftentimes it is worth doing. And but again, a very personal decision for patients.
Thank you. Those are some great words of advice and insight. I appreciate it. Jason, why did you choose to become such a vocal advocate, aka Superman HPV, and share your story? And how has that supported you in your journey?
Thank you. Let me first say that in case anyone's never heard of Superman HPV, I do not think of myself as a superhero. I'm not arrogant. I do not have a Superman complex. My friends called me Superman during chemo and radiation, so I adopted the name to draw attention to a diagnosis I had never heard of, just so we're clear about that up front. So when I first got diagnosed, I knew no one to be diagnosed with this, and I was worried, honestly. They said 7 weeks chemo, radiation, a feeding tube, and I made videos to my kids saying goodbye. And I love my family, and I decided that if I could stop other parents from ever having to make videos to their kids saying goodbye, that it was my obligation to do so, to educate people about HPV from a non-doctor perspective, obviously, HPV, the HPV vaccine, and HPV related cancers. So I honestly felt obligated. I feel like a parent's job, again, this is my personal opinion, not that of anyone else, although probably, I think a parent's job and responsibility is to protect their kids. And if I could go public, educate people about the HPV vaccine to protect their kids from HPV preventable cancers, it was my obligation. So that is the reason that I went public. Also, when I scoured the internet for information, everything was really negative and depressing. And I found out that most of the things I was reading about were comments and concerns from people that had head and neck cancer caused by excessive alcohol use and smoking, not from HPV. And so I wanted to provide an inspiration, a website that would provide inspiration and information for those searching for that.
And I know you talk with a lot of other patients or survivors or those going through treatments. What kind of support or advice would you give to someone diagnosed with an HPV oral cancer or other type of HPV cancer?
Again, Dr. Fackery might be correcting me, so please, if you need to, please do. But when I did my research, I found that there was an 85% chance of survival with HPV-related cancers as compared to some other cancers that cause head and neck cancer. And so I want people to know you will be okay. I mean, listen to your doctors, trust your doctors. Everyone's situation is different. But I do tell people, because they panic, just like I did when they heard they had a cancer diagnosis, you will be okay. There's a high likelihood your life will be back to normal. It might be a new normal. You will be able to live. And that's why I work out, honestly, to give people inspiration that they can too get back to a normal life. But I say, find something good in every day. Even with the hell of treatment, you find something good, and that it's all temporary. And most people can survive anything when they know that what they're going through is temporary and that they will be okay.
Yeah. Sometimes we get questions about, if you've had an HPV cancer, is it too late to get the vaccine? Is there any point in getting the vaccine after the fact? Is that any kind of recommendation, Dr. Fackery?
So from what we know to date, there really isn't a role for it, because the patient's already been exposed to it, and the vaccine is against a different type of antibody, which generally patients already have, even when they're diagnosed with cancer. That being said, there is a clinical trial in cervical cancer to see whether or not giving the vaccine after they've been treated for their cervical cancer reduces the risk of having another cancer. So we'll at least have data from cervical cancer to help guide this question better in the future.
And is there any other test to know that you have HPV other than a PAP?
So the PAP test evaluates whether or not there's HPV in genitally. Are you asking in the blood or in the oral cavity?
Right.
So we don't have a commercially available test. Actually, I take that back. There is a commercially available test for the oral cavity and oropharynx. The problem is it has not been validated. So that is out there. And even having that knowledge, we don't know as physicians what to do with it. And so I think for many reasons, it's probably not something that we would recommend. And there are no screening guidelines for oral HPV. There is a blood-based test that is out and available for HPV, but it's for patients who have had cancer that is HPV related. And again, we're way out of guidelines. And so I don't think that we can make a recommendation to do that either.
Okay.
Am I allowed to make a comment about this? I know it's a little bit off center, but as a non-doctor, I always tell people, when you go to your dentist, make sure you have an oral cancer screening. If you have a sore in your mouth that's not healing, if you find a bump on your neck that appears out of nowhere, go see your ear, nose, and throat doctor. So I just wanted to make that comment based on the fact that there is no, nothing medically, I guess, approved, as Dr. Fackery said, just to mention that.
Very important points. Awareness and prevention can help prevent these types of cancers. And Dr. Cash, for patients who are struggling with mental health during and after treatment, what are some of the resources that might be available, especially if maybe a patient doesn't have a large academic or multidisciplinary center that offers that support?
Yeah, sure. That can be really challenging when the resources are not widely known or readily available. I always encourage our patients to check with their oncologist, check with their primary care physician, kind of clue them into what's going on, see if they have recommendations or referrals. Sometimes there are, psychologists or psychiatrists or social workers who are known to our physicians that have experience in working with folks who've dealt with HPV-associated cancers, and so they may have good recommendations for patients. And then the widely available resources through the Head and Neck Cancer Alliance, the HPV Alliance, National Cancer Institute. All of these resources are available with information directed towards patients that can help them gain some knowledge, gain some of the information that they need, and find resources that might be either something that's nationally available, like a phone center or hotline that someone could call for immediate support, or maybe a listing of local resources that might be available to them as well. There are, lots of cancer-based community organizations. We have one in Kentucky, the Gilda's Club is here, and so they offer a lot of support groups and individual and family counseling as necessary. So it takes a little bit of research and looking around, but I encourage our patients to kind of use their networks, get in touch with their physicians, look for the list of providers that their insurances will cover, and start seeking out support from those resources as much as possible.
Thank you. And thank you for mentioning the HPV Cancers Alliance and the Head and Neck Cancer Alliance, both of the organizations that are hosting these webinars today. We have many resources on our website. In addition, the Head and Neck Cancer Alliance, we do offer a clinical trial finder too. Dr. Fakhri mentioned that at the beginning. And for patients who are looking for those options, that's another resource that we have available. So I would just like to thank everyone so much for their participation today, and insight and wisdom. And are there any final words that anyone would like to share?
Thank you for all that you're doing. And thank you, Jason and Liz, for sharing your wisdom.
I appreciate everyone as well. Love being on the board of the Head and Neck Cancer Alliance, as well as being involved with the HPV Cancers Alliance. So thank you, and thank you, Amanda. Thank you, everyone.
And I would just echo that I'm thrilled to see the work that the organizations are doing. It's really, I've not seen an effort to put into the public eye this information so well organized and so comprehensive. So it's just really astounding how effective this organization is, and how well things are working. So I'm just pleased to be here and a part of what's happening.
Thank you, everyone.
Thanks.
Thank you to all of our panelists today. We so appreciate the information and insight that we know will help many people. And now I would like to bring back Marcia Cross to offer some closing remarks.
Well, I cannot tell you how happy I am and grateful for this incredible webinar. And I want to thank the Head and Neck Cancer Alliance and HPV Cancers Alliance for making this happen, and of course all of our wonderful sponsors. So thank you, thank you, thank you. For all the panelists and doctors that were involved in this incredible webinar today. I am so happy that we're all committed to ending the stigma around HPV and HPV cancers, because as you know, I feel it's ridiculous. It's like being ashamed to have the common cold. So I want you all to be brave. Talk to your friends, have your friends talk to their friends, and like that shampoo commercial a million years ago. Before you know it, everybody will know about it, and we can end the stigma, because ending stigma means saving lives. So every time you're brave enough to have the conversation, think about it as, oh, if I do this, I might educate somebody, and by educating them, I could save a life or two or more. So that's my encouragement to you. If you have someone who's interested in hearing this and missed it today, then it will live on our Facebook page, the HPV Cancers Alliance. And again, what a wonderful day. Thank you all, and go out there and be brave. Have courage, that you can save lives. Thank you.
Marcia, thank you very much for those meaningful comments and for your contribution to the cause. I also would like to thank all of our speakers today, as well as our amazing partners at the Head and Neck Cancers Alliance. This has been a wonderful collaboration. Amanda and Eileen, it's been a great pleasure to work with you, and you've been amazing. I also want to thank all of our mission partners, which are too many to list. They always support us by sharing information on our events and encouraging their members to attend, and we do the same to support their important programs throughout the year. On a final note, As the Executive Director of the HPV Cancers Alliance, I would like to sincerely thank all of the organizations who enable us to support important programs throughout the year like today's webinar. These generous supporters provide us with independent grants, and I would like to thank Merck & Company, Inc., Quality of Life Labs, the Amino Up Company, and Tridepia Corporation. We are extremely grateful for enabling us to spread the knowledge to save lives. Thank you to everyone who invested their time to join us and to the Head and Neck Cancer Alliance today. Please share what you have learned with others and help us get the stigma out of HPV so that we can prevent cancer and save lives. Thank you.